Good afternoon, everyone, and welcome. And thank you for joining us today for what I'm sure will be an inspiring and motivating presentation from our speaker, Damien Newman. He will talk to us about Thrive, a charity that has been using social and therapeutic horticulture and gardening to change people's lives since 1979, when the idea that being in and participating in nature was not at all widely recognised and accepted as therapeutically beneficial. And this is perfectly articulated by the short video by founder Chris Underhill on their website. Damien will help us bring that message into the consulting room, highlighting the value of nature, gardens, and gardening for self-care in practice, the potential of green social prescription and its unique values within wider social prescription, and how elements of biophilic design can be incorporated into GP practice settings. My name is Wendy Tyler-Batt, and I'm one of the directors for Greener Practice. But before I hand over to Damien, I would just like to tell you a little bit about Greener Practice. So Greener Practice is a not-for-profit community interest company, enabling primary care to become more environmentally sustainable. And we do this through our network, working in partnership with individuals and organisations that share our values, and through our Greener Practice platform. So if you haven't visited our website, please do take a look. It's a great way of making connections through sign up to your local WhatsApp group and national special interest groups, and all this and receiving national and local newsletters, and some of the resources are free. There is in excess of 50 off-the-shelf QI projects and more resources behind a modest paywall. These can provide evidence for multiple CQC standards and other quality improvement standards too, including medicines optimization and safety, which not only contribute to environmental sustainability, but save you time and money. It also helps to complete many actions in the Green Impact for Health Toolkit, which can be accessed through our website. And this is a great framework with a whole team approach to chart your sustainability progress. And this is now run by us at Greener Practice. Membership is free as an individual, and for this you will be able to network and join your local and national groups. And then these are the different levels of membership shown on the slide here. And there's a QR code for you to be able to scan and investigate further. And if you join us, you'll be able to use your logo on your organisation website and so forth. And just to mention that information that is shared today is accurate to the best of our knowledge and is to inform and educate, and it's not a substitute for clinical judgment. So I'll now hand over to Damien, and then at the end of the session, I will put up this slide again, which will be for you to give us some feedback. But during the talk, please do put your questions in the chat. But hopefully we'll have some time at the end to do this. So anyway, thank you, Damien, and I'll stop sharing my screen and hand over to you.
Hello, everyone. Real pleasure to be with you. I'm going to present on the subject of gardening for health from an everyday life perspective, all the way to how we think about it as a health intervention and where we are currently in the state of that development in relation to green social prescribing and things like this. Apologies if I had to clear my throat a little bit. I'm just getting over the last of a cold that I had for about 5 or 6 days. So apologies for that. At Thrive, essentially, I look after Thrive's education and consultancy work. So we have sort of short courses and all sorts of other sort of all the way up to higher education diplomas and awards that can be useful as CPD for all sorts of health professionals. And we get involved in all sorts of projects supporting the general sector and development of the idea of nature-based interventions. So in this presentation, I'll share a little bit about our work on developing the foundational principles and essentially guidance on what constitutes safe and effective referral processes within nature-based intervention and green social prescription. And so that's some of our sort of consultancy work there. I'll talk about our services a little bit more right at the end, because that'll put it into context of how they might be useful to you. But essentially, just to finish off my introduction to myself and Thrive. For us at Thrive, essentially, we are a people organisation first and foremost, people and gardens. We view gardens as a route to health and wellness, essentially, and we see across our 3 sites with upwards of 250 people each week accessing our services with our own eyes, real transformation, real development, real growth, real recovery and real resilience through what we do. Essentially, we have a person-centered approach, a practitioner who manages the whole process. And like I say, we work in a way where we're always focused on the health side of what we do rather than necessarily thinking about our gardens as outcomes themselves, or even environmental issues and things like that, although obviously sometimes they go hand in hand, as I'll explain. In the introduction, when you very kindly referenced all the way back to 1979 when Chris Underhill started our charity up, and around that time there had been in the 70s, perhaps growing out of some of the sort of environmental movements that we saw in the 60s, an idea that a return to nature or connection to nature seemed to be valuable and appeared to be act as a therapeutic thing for people with needs. And so, as well as Thrive starting up, the American Horticultural Therapy Association starts up in 1974, and you get the beginning, certainly in the anglicized world, but also in places like Japan and Korea, of concepts like horticultural therapy and things like this. As we fast forward over the sort of 50 years nearly that Thrive have been going, then we arrive at a time where right across the world, essentially there is a great interest in the way that nature can be useful to the health services and health systems, but also, directly impactful on the health presentation and wellness levels that we see across individuals on that sort of both community and societal level. And this is one way of breaking it down. This is from Green Me, which is an EU Erasmus project, essentially, that's been set up over the last few years to start to help us to standardize some of the language that's being applied right across Europe. We'll talk about the complexity of language a little bit as I go through this presentation. But you can see these three clear ideas here: nature in everyday life, nature-based promotion, and nature-based therapy. And this can be applied if we think about it in the way that we actually, use this knowledge. We understand now from the evidence that I'll sort of explore with you in a moment, that essentially everyone benefits from being connected to nature. You can see it in the way that in some parts of the world, having no access to nature goes hand in glove with essentially poorer socioeconomic circumstances. And so, nature in everyday life can be very accessible to some people, but not always accessible to all. But the evidence that's out there suggests that all of us, regardless of our health presentation, all benefit from some time in nature. And of course, that's where Wendy was introducing this idea that for you as GPs and people who work in GP services, actually you can make value of this in the way that you think about your own self-care and your own ability to remain, really valuable in practice and congruent in the way that you work and things like this. And so nature in everyday life, actually Sir Richard Thompson, the chair of the Royal College of Physicians, who was a long-time supporter of Thrive some time ago, would often comment on how when he went to conference, he would often talk to other doctors who gardened, and sometimes they would collectively notice how they were some of the healthiest in the room. And so, although it's, not just for, not just when life stings, but also when we're trying to be resilient, when we're trying to just manage the stresses that come across our lifespan and the way they come at us at different times in life, then nature can be a good salve to that. And we engage in all sorts of different ways, and I'll explore that a little bit at the end of the presentation, but I will focus a little bit more on how gardening works. Obviously, there's nature-based health promotion and the idea that, there can be community type activities or perhaps, funded through other, community routes rather than it being something that's just simply down to, Public Health England and the concept of health promotion. So it could be community-based health promotion as well as nature-based health promotion. But this particularly might be valuable for groups of people on the periphery of ill health, essentially, people who may well essentially be a regular visitor to a GP, somebody for whom a little bit of concern for health has started to creep in. And obviously, as GPs always know, that when people are starting to feel aches and pains and things that aren't quite right, then often the mind and Dr. Google will push people towards all sorts of more drastic conclusions. And so building a upon that sort of way in which people engage with their own perception of health, these nature-based health promotional activities could be really valuable, and perhaps something that people like yourselves can signpost to, not necessarily through the green social prescription route, but essentially as recommendations, as suggestions that GPs can share. You know, a lot of consultation time is spent on that sort of idea of trying to highlight the things that might prevent it in the future and things like that. And maybe part of that consultation time could be, recommending that people could join the local wildlife trusts volunteer program as a way of getting out, getting exercise, meeting new people and staying connected without even the need of a link work or it to be an official social prescription. And then we get nature-based therapies, the idea that essentially there are ways in which we can arrange nature and guide people through nature and provide people a person-centered approach within nature that's essentially directed to be more curative of specific health conditions or specific, disability presentations and things like this. And obviously that can be people with long-term health conditions, people with mental ill health, but also perhaps people for whom essentially life has come along and provided a curveball. The evidence for this has been building for quite some time now. As Wendy introduced me, when Thrive set up in 1979, a lot of the research would have been very sketchy and quite difficult to, usefully use as a doctor, as a GP, in the way that you suggested that people should be connected to nature and things like that. Although I'm sure it's always been a common recommendation by doctors who themselves garden. This nature connectedness piece of research essentially looked at the evidence that comes across 75 countries and essentially, demonstrated that nature connectedness and well-being seems to have a fairly significant predicting factor for well-being across the world. It noted also that essentially the relationship is moderated by cultural orientation. We all have a different relationship with nature, and that relationship with nature can be quite cultural, and it can be quite nation-based, or it can be quite regionally based even. And this makes a slight difference. People want to engage in nature in a way that's suited to them. And when they do so, the evidence suggests that the value of that intervention increases. It noted essentially that nature connectedness, people who feel more connected with nature, people who spend time in nature more regularly, that it acts as a resilience factor, not just at an individual level, but a country level. And in, Sue Stuart-Smith's book about the wild garden mind and things like this, we can see evidence of the way in which quite commonly in natural disasters, people return to nature and often engage in acts of gardening and cultivation of plants as part of the healing process. Some of this research, and I could have chosen many different studies to highlight this, essentially all falls under this concept of biophilia, or the biophilia hypothesis. First put forward by Edward Wilson back in 1983, the fairly famous biologist. He put forward that essentially that, we all have an appreciation and a love of the living world. So bio being life and philia being love, obviously. And that perhaps we almost have a genetic response to greenness and certain environmental conditions. He broke down human evolution into a week in his book, The Human Connection with Other Species, and points out that we live like all other species in equilibrium with our environment until, around about halfway through the final day of the week. And then it's not even until a quarter to midnight that even 25% of the world's population don't live a life of constant contact with nature. And so he essentially concludes that if we take evolution as fact, it's only logical that we're much more bound to our natural environments and much more regulated by them than we can possibly be regulated or supported by the environments that we built for ourselves. And underneath this sort of very grand theory, although you could argue that it could go grander because it's not just the living things in our environment that support us, the big blue open sky and things like this. And all of this can be accommodated in the way that we think about design of health settings. And it was Ulrich's view through a window who really started to make this argument really strongly. Perhaps some of you have come across this study. It is quite famous, but essentially Roger Ulrich, a healthcare design specialist, essentially, they measured the way in which patients recovered from gallbladder operations in the same clinical setting, same hospital. You can imagine the scene, a nurse's station splitting, 12 or 16 beds, something like that. 8 beds on one side of the station looking over a brick wall, 8 beds on the other side with a view of trees. Essentially, you saw a reduction in recovery time. People were discharged sooner. People asked for less analgesic medication, and people's emotional state was noted as being much more positive when they had that view of just a few trees. And these were attributed by Ulrich to this concept of stress reduction theory. Essentially, through our sensory perception, we take in cues that exist within the natural world to essentially say we're safe, we're okay. And that's where that greenness becomes so important, because greenness cross-culturally comes out as an important color for relaxation and calming. And it's probably linked to the evolutionary nature that green essentially signifies health of an environment. Essentially, food, water, and shelter is available in a green environment, and our evolution has helped us to recognize that at a subconscious level. And of course, that evolutionary angle of it doesn't just go for the human species. Some of these things are leftovers from species long before us. If you ever wonder about the way in which a pig will spend 24 hours a day rooting through soil in order to feed itself, and that link to the fact that if we put our hands in soil, we can actually measure rises in serotonin. And so, perhaps all mammals in some way get a nice puff of the positive stuff every time we come into strong contact with nature. And all of this all of this evidence here, it's all universal. Essentially, we can apply this way of thinking not just to people who are not so well, but also to people who are perfectly healthy. We can see a short stimulated, one sort of snapshot piece of evidence I thought I'd include in this presentation was, a little investigation into the way that a short simulated nature experience can be an effective way to promote restoration from work-related stress. Essentially after cognitive challenge, people were shown a short 5-minute video, just 5-minute video, either nature-based or urban-based scenery, and different methods were used to collect the way in which we could recognize the reduction in stress. And it produced statistically significant improvements in stress levels within those who were viewing the scenes of nature. So that's not even going outside, that's just looking at videos. And again, this can be incorporated, and I know it already is, into lots of GP surgeries with views of nature and things like this, skylights, being, or tiles in the roof being replaced by a blue cloudy sky with a light just behind it shining through. You see these things within GP surgeries and other healthcare settings, and this idea of biophilic design can certainly be taken into the way in which we think about the images we show, what's on the televisions, the way in which we want our entrance into the surgery to be one that's quite plant dominated where it's possible, and things like this. So this is the universal stuff effectively. But we also know that essentially there are people who are obviously, reporting to GP surgeries with long-term health conditions, be they physical or mental. And for them, perhaps they need more than nature in everyday life. Although an affirmative sort of recommendation from a GP, that old study on, paracetamol that's dispensed by a GP is 10% more effective. Well, if you can be confident in the way that you recommend nature to patients, I think that, inevitably there's that element of placebo about the whole affair as well. On this model, you can see the way in which these things, different ways of which you can engage with nature change, and the arrows are there to show that essentially people might need these different ways of connecting with nature at different stages of their life, at different states of health. That slide with the circles there trying to describe the sector between, those everyday life, those health promotion, and those green care or nature-based therapies, as we tend to use as a description these days, were presented in the Natural England report on nature-based interventions back in 2018 using this one. And you can see, like I say, the complexity of the way in which these things are presented for you isn't helpful at all. And that's essentially because all of this network of nature-based interest and, whether it be environmental conservation groups or whether it be social and therapeutic horticulture working with people with defined needs, they all start up from different inception points. This slide really does represent how politics and organizations, trying to, not for profits, very understandably trying to make sure that they're not essentially cut out of the deal, are represented here. And things like, community food growing as a treatment intervention, which to me is just the same as social and therapeutic horticulture. So we've got a lot of work to do on our messaging to help people understand. But I just wanted to bring up this slide to show that there is a variety. So, ecotherapy is probably best defined as like a talking therapy in nature, whereas social and therapeutic horticulture is much more occupationally based. Similarly, some animal assisted therapies are working on psychology in the relationship between people and animals, whereas care farming tends again to be more occupationally based rather than necessarily based on just relationships between people or just relationships between people and nature and people and animals and things like this. So around about that time, obviously, 2017, you had a growing interest starting in relation to social prescription. People like Michelle Howarth and people like Dr. John Fieldhouse and others doing great work to essentially demonstrate that there is a good number of not-for-profit and community assets out there that could be potentially used as a health referral route, because at the same time as people in nature-based interventions demonstrating their evidence base, you've got people in art interventions and craft interventions and art interventions who are all doing similar. You have the emergence of art therapies, and things like this at the same time as green type of therapies. And so once the Green Social Prescribing Programme was established in 2020, they set up 7 different test and learn sites. And from this point, we're able to be a lot more helpful now, I think, towards GPs and other health professionals, for them to be able to understand how they can make the most of what's on offer in these different green social prescribing situations. And you can see the outcomes that people were looking for. And essentially the results and findings from that first phase were generally very positive. That number of 8,500 in those 2 years across those 7 just test and learn sites. So that's not nationwide. We would estimate that number could be anything up to about 50,000 to 100,000 people being referred into green social prescribing now. They showed exactly what some of the other pre-pilot studies showed, if you like, which is there's really strong engagement, 85% uptake of green social prescription. That's an uptake of a prescription that most people would see as being very, very healthy. And often people's commitment to it is a form of health recommendation or prescription, although that word is a tricky one in the light of the concept of social prescription, I think. That's really good news for everyone. And what we could see is that essentially, in comparison to other mental health interventions, it was relatively cost effective. There are other studies now that compare it with CBT and things like that, and again tend to find that certainly horticulture therapy, or social and therapeutic horticulture as we call it in the UK, tends to produce quite similar statistically significant outcomes in relation to things like anxiety and depression as we see from CBT and other talking therapies. And so again, some of the pressure of the health service could be relieved through the acknowledgement of these different opportunities when waiting lists can be so long for the talking services. And with all of that work comes essentially lots of good policy document and the development of referral processes and things like this. So we were involved with NASP, the National Academy of Social Prescribing, in the development of green social prescribing practitioner guidance, essentially trying to provide some foundational what's the word I'm looking for here? Foundational principles in social and therapeutic horticulture. And the way in which this was thought of, again, there's progress here in the way that we're able to support GPs to identify specifically which person from which sort of patient group, how are they presenting, how are they coming out when I think about them in terms of their level of mental health need in particular, and how can I support them and how can I understand green social and nature-based interventions as a sector to be confident that I'm referring in the right way. And so we use this way of thinking that was put together with all sorts of different partners, Green Me, Thrive, and people at University of Essex Green Exercise Team, and also some clinical commissioning groups. up in Nottinghamshire, sorry. And essentially we were able to think about the way in which our model, our circles models, might be played out across the different levels of mental health as described by the NHS, and the way in which services are catered towards those people. I would actually argue that this nature-based therapies can be taken into that fourth tier. This representation of the model is specifically for the green social prescribing documents, so we didn't want to muddy the waters there. But essentially, I first came across the idea of using nature for health and first saw its, impact firsthand, if you like, when I worked in mental health services, forensic and medium and high secure settings. And essentially, it's in these places, it was in the places we used to call asylums, that many of this, that some of the earliest beginnings of using horticulture as therapy can be identified. And so, under the guise of occupational therapy, we do see horticulture therapy, social and therapeutic horticulture utilized within secure and residential health settings as well. But by being able to develop the standards and the guidance to a depth that is valuable to both the deliverers, the nature-based interventions, the army of thousands of often not-for-profit organizations working on shoestring budgets to try and provide free access to people with needs, is supported, and that recognition of when people perhaps have a higher level of complexity within their need, we need to be finding the right nature-based intervention for that person rather than necessarily whatever's the first available. So I just talk a little bit about, a more, what's the word I'm looking for, a nature-based intervention program or way of working with nature-based interventions that is more supportive to people at that sort of more complex end of needs. So this essentially represents what we do in social and therapeutic horticulture. Here, essentially, we mix these valuable opportunities together. Each one has its own separate evidence base to tell us how valuable it can be to people's holistic health. And essentially, that's what lots of nature-based interventions work with. They work essentially with people's holistic health. Although they can be targeted to specific outcomes, the medium itself is holistic because of all of the different multimodal elements of the model, essentially, because there is a relationship between the people and nature. There's a relationship with activity and occupation, and that occupation is meaningful. So it really does tick all of the boxes of why occupational therapy works. And then, of course, you're doing this in a social environment. And as anybody who ever goes for a walk in the countryside knows, we're all much more pleasant to each other in that environment. As the Kaplins who put forward attention restoration theory would say, we become more agreeable. And it's within that agreeable environment that this social environment becomes a very positive social environment. Everybody willing each other on to success because we're calm by nature and because we have the shared task of nurturing living things into life and watching them come to maturation and enjoying all of the fruits of our labor, quite literally, as well as in a more sort of meaningful way in our own minds. And this is what happens in social and therapeutic horticulture. These three valuable opportunities for health and wellness come together. And then we add the practitioner into our model. This is the guided model, essentially, that we use to teach a lot of what we teach on our diploma with. We have a practitioner. We like that way of describing ourselves. We don't like the term therapy because we believe that it might over-egg our bake a little bit. We don't want to raise people's level of assumption on the quality, particularly when we're an emerging profession and not quite established yet. So people who work in Thrive and other places like this, they tend to be referred to as practitioners. They'll be trained, they'll be educated, they'll know their stuff. And essentially within this model, you can see the different arrows and they represent a relationship. And of course, the relationship between a practitioner and the client gardener, the person who comes into the box there, that is the whole of social and therapeutic horticulture, the whole model there. Obviously, you want to develop rapport, you want to build trust and faith with that person. But actually, it's not the only therapeutic relationship within this model. There's a therapeutic relationship in relation to the person's affinity for nature or their nature connectedness. There's a relationship between the person and occupation, where so many physical skills can be relearned and redeveloped alongside cognitive skills, alongside psychosocial skills can be developed through that teamwork, through collaborating over the nurturing of plants and the building of gardens. But also, you know, a relationship with the social environment. For many people, that break of being isolated, that connection with other people could be, you know, a key that unlocks progress in all sorts of health directions for that person. For us, it's really important that we understand the relationship between that person and outcomes within their health and wellness. And critically important to us is that we understand how those health outcomes are then transferred into people's lives within the community. So this is a real, you know, care farming could present its own model, animal assisted therapies, ecotherapies, the other type of nature-based interventions could all present their own models and their own knowledge base. I'm just giving you a flavour of how we work at Thrive and how social and therapeutic horticulture, which is the largest and most common nature-based intervention in the UK, how it works and essentially how it person centres itself in the way that it supports people to health outcomes and holistic general health as well. And I'm just going to share a little bit of evidence that's specific to social and therapeutic horticulture or horticultural therapy. In the UK, we just prefer that term because it essentially it tips its hat to the importance of the social domain, and we feel as if, you know, that's in all of the evidence, essentially at least a third of it comes from the social side rather than necessarily the plants. And so, but we can see from this meta-analysis of RCTs, because there have now been a few RCTs around the world that have been able to look at specifics in relation to horticultural therapy. And essentially, this was one that looked at a range of different ones in relation to mental health, and found again that across the different studies, there was significant and positive impact on mental health in comparison to control groups. And so we are at that point now where, although we're in an area where evidence is really quite hard to collect, you know, if you think of the difficulty of getting through ethics with the idea that in some way you lock people up away from nature and things like this. So to try and eradicate every variable is really tough in the trials. And, you know, thankfully, there's been a little bit of softening for real world data gone on at the same time as we've got better at putting these studies and putting this research together. And again, I could have chosen a completely wider ranging set of research to present to you. I could have, you know, looked at things in relation to the way in which it supports psychosocial development in children. We could have looked at the way in which it can support people post neurological injuries. All of this evidence base is out there. And when I share the presentation with the Greener Practice team, I'll include some links towards all sorts of useful things if any of you did want to read up on it or pass it on to others to have a bit more of a deeper investigation. So with the way in which we work at Thrive, essentially we can be supportive to you in a few different ways. So I've touched on that value of self-care, and I'll wrap it up a little bit with a few images in a moment as well. And we've touched on that value of potential biophilic design that can be incorporated into GP services, but also obviously the importance of the green social prescription movement as part of the wider social prescription movement, and how through link workers, it does, you know, it is one route in which perhaps some of the pressure can be alleviated from primary care, with more and more people feeling as if maybe they get the check-in, maybe they get the presence they feel of medical people being interested in them. Maybe they start to get that from attending these other groups. And perhaps that reassurance comes to them more through the community rather than through the GP services. I'll just outline our services just before I finish off with a few ways of thinking about different nature connectedness. Essentially, across our 3 gardens, we have social and therapeutic horticulture programs. We deliver information, and the side of what I do, training and education. So the information service is really potentially valuable. This is essentially on our Thrive website. And like I say, I'll share the links at the end with the Greener Practice team. And essentially at thrive.org.uk, you can access the Get Gardening side of our website. And there are over 1,000 articles on this website now, and they're all specifically about gardening for health and wellness. So you can see I took this screen capture sometime in the winter, and so every season we produce a calendar of wellbeing activities that people can engage in within their own home. There are articles on there on how to develop your garden with sight loss, how to garden from a seated position, how to garden with children with autism, how to garden to support mental health. Pretty much every health condition has a place within our website, because we are a pan-disability, pan-health organisation. So we believe gardening has a value for all of those different groups. But people connect with nature in different ways, and we'll come on to that in a moment. For anybody who's interested in learning more from us, we have a whole host of courses, some of them available online, some of them face-to-face. Visiting a Thrive garden is always quite possible. And so learning from us and learning about the sector, you can do this through Thrive, or somebody within your team could perhaps do this through Thrive if they were interested in finding out more. But we're not the only organisation that's useful to you as well. If you haven't already, then the Gardening for Health directory that I've got a screenshot of here is set up by GP Dr. Richard Claxton, who perhaps some of you on the Greener Practice team may know of. And essentially he started cataloguing horticultural therapy settings within the UK, and you can see there is pretty good coverage. Trellis, another organisation similar to Thrive in Scotland, they look after Scotland, and so that's why you don't see any up in Scotland on this map, is because the good people at Trellis are already taking care of it there. But Gardening for Health is a really good directory. Link workers could be using it all of the time, but essentially there's no reason why GPs couldn't have a quick look as well, or at least pass it on as a resource to people who make that strong recommendation to get gardening, get connected to your community garden and things like this. At Thrive, like I say, we have 3 different gardens. This is an image of the garden that I'm often at just south of Reading. Here we work with about 100 people each week, and the predominant group who access this garden are actually adult social care clients, people essentially from local authorities with long-term health needs. We do run our working out program here as well, and the working out program is a 16-week program that is aimed at supporting people who are recovering from a significant health impact of some description. So, you know, musculoskeletal injury that perhaps has left the person using a wheelchair, a significant neurological injury where perhaps the usual outcomes at the end of primary care have not quite been achieved, people who perhaps have struggled from a mental health perspective to come to terms with the loss of a physical function and things like this, people recovering from cancers. All of these different people can access our working out program. In our gardens in Birmingham here, we're renovating the old television gardens, if any of you are old enough to remember Pebble Mill or Jeff Hamilton presenting Gardener's World. And here, again, you can find our working out programme. We're exploring or opening up our gardens to social prescription, although at the moment without a fee attached to delivery. Essentially, we do have referrals that do have fees attached. But there are lots of other places around on that Gardening for Health, I say. But then our other gardens in London and Birmingham and Reading could be useful contacts for you as well. But as we see from this image here, this is an image of our gardens in London, isn't it stunning? I mean, this garden is essentially created by people with ill health and disability. And every day this garden in London, this is the Old English Garden in Battersea Park, it's visited by about 500 people. It's a public park. And essentially all of those people are getting improved health and wellness outcomes because of other people with health and wellness creating beauty, looking after a garden and creating essentially a space that people feel safe within. People are essentially being stress recovered, and all of these wonderful things are happening because of people with significant health and disability challenges. And so to be part of still being able to give, still being able to provide, still feeling as if you have a usefulness is one of the wonders of social and therapeutic horticulture. People who are not well themselves caring for others, a role that's often taken away with disability and health conditions, that role to care within your family, within your community. And within our gardens, you get that opportunity. But of course, for many of us, plants are incredible. They're stunning. They fascinate us. I myself, probably, if I'm not talking to you, I'm thinking about my own garden. It really does become obsessional for some of us. The beauty of plants, it's just all there, isn't it? And there's something quite magical about being involved in their nurture. But not everybody perhaps wants to grow pretty flowers. Some people want to grow vegetables and take home a harvest and things like this. And maybe some people aren't even that interested in gardening. Perhaps for others, it's about going down the river for a day fishing. For others, it could be a conservation group. It could be a walk along the beach. It could be a walk in the countryside. Everybody has a different affinity for nature that's essentially, biophilia through the prism of culture creates our own affinity for nature, our own nature connectedness. Some of us are lucky enough to have it quite deeply in our lives. And as the evidence suggests, we are healthier and happier people, potentially with extended quality life years because of it. And so whenever we're able to connect people to gardens and nature, we're probably doing them a really good thing. But at Thrive, we do value that collaborative stuff. We value the social connection that comes through gardening in groups, and we believe that those combination of valuable therapeutic opportunities, time in nature, time being occupied, and time in a positive social environment can make a big difference to lots of people. John is just one of our case studies, essentially, but a really powerful one as somebody who'd spent literally 20 years with serious mental health issues, struggling with homelessness and what have you. But he came to Thrive and he found there that he could connect with other people, that, he was treated with equality. It didn't feel like it never feels like a clinical setting, even if we're working at that level 4 model within, mental health services in high and medium secure. Even there, the hierarchy is slightly reduced, and people who are perhaps resistant or in some way less confident to engage in healthcare, they can be helped by these sorts of interventions as well, in the way that it essentially creates this level playing field. John's a great successful story. We've seen it with our own eyes many times. And there is just something truly magical about being involved in nurturing other living things and feeling the benefit of feeling as if you're a good, positive human through that process. Thank you.
Wow, thank you so much, Damien. That was just brilliant. We haven't got any questions in the chat, so that clearly means that you've covered everything absolutely brilliantly. And I expect largely you are preaching to people who are already converted, who know something about this and the benefits, but the additional layers of information that you've shared with us today have been absolutely brilliant. So really very much appreciated. And I love the term biophilia, which I hadn't actually come across before, and how different types of biophilia appeal to different people and work for them. So, and also just the sort of the basics really of making sure that we include this on an informal level in part of our everyday consultations. And of course, it's not just now GPs, it's nurses and it's pharmacists and other healthcare professionals that are involved in picking up the pieces and helping people to stay on, or not fall off the track, as it were. So and I must remember that all the healthy doctors I see are probably really into gardening, so that's a good thing to know. But yeah, and this holistic medium is so important, isn't it? I think we know that the being together, the gardening, the purposeful activity, it's sort of it's really, really sort of heartwarming to see how it's becoming so much more mainstream now, and that we have some evidence now, which has been really hard to get, but we do have that now, which is also really very, very good. So I don't think there's any, if there aren't any questions or anyone wants to come off mute and say something. Richard Claxton is well known to the greener practice community. You'll not be surprised to hear.
No, not
So
at all.
I'll just share my screen so that people can do the, hopefully give us some feedback. So that's that. Hopefully you're seeing that. Yeah, okay. Okay. Is there anybody that would like to come off mute, or anybody who'd like to put some in the chat? So say speak now or forever hold your peace. But I think we've all agreed that that was absolutely fantastic presentation that we've been dying to hear. So and we're really pleased that you're going to be sharing the slide set with us, and we will get your recording put up on our website as soon as possible.